Hello friends, in this video we are going to talk about the changes introduced in the MRCS Part B OSCE exam on and from October 2020. There has been multiple changes introduced in the MRCS Part B exam. Some are permanent and some are temporary due to the Covid-19 pandemic. Let us talk about the permanent changes which are introduced. Before that, let us know what was the examination pattern. Until now there were 18 stations, out of which 8 stations were the knowledge and 10 stations were the clinical skills. Out of the clinical skills stations, 4 were the physical examinations, 2 were the history taking, 2 were the procedural skills, and 2 were the communication. As we can see in the article dated 18 December 2019, this states that the number of physical examination stations will be reduced from 4 to 3, and thus the total number of stations has been reduced from 18 to 17. But at the same time, if we can see it, look at the point number 3, it says that there is routine inclusion of a pilot station. Let us understand what this pilot station is. Every new scenario used in the MRCS has to be piloted to ensure its internal reliability and validity. These stations are scored by the examiners, but they are not included in the result. So altogether, the number of stations again becomes 18. There is also incorporation of the health promotion in the MRCS syllabus. This might include more emphasis on the physical and mental health, and so there might be more stations related to patient counseling in the communication stations. We can see in the last point there is incorporation of the patient safety in both anatomy and procedural skill stations of the exam. This indicates the anatomy is going to become more applied, and the patient safety has always been a core of the MRCS exam. So I don't think this will going to be a new change that the candidates are going to face. These are some of the permanent changes which are implemented from October 2020. Let us talk about the temporary changes which have been introduced due to COVID-19 pandemic. Due to this pandemic, most of the overseas exams have been postponed. Currently, exams are being held in UK in a changed format. Now, as we can see in the article dated 3rd August 2020, these changes are supposed to be implemented from October 2020. According to these changes, the number of stations overall have been reduced from 17 to 13 by reduction of the procedural skill stations from 2 to 1, history taking stations from 2 to 1, anatomy stations from 3 to 2, and pathology stations from 2 to 1. It also states that the physical examination stations will preferably be conducted without a patient or an actor. This will include mainly discussion of the signs and symptoms, the associated diagnosis, and investigations and management. So this is going to be more theoretical exam. The procedural skill stations will again be preferably done without an actor. So we will probably be provided with the mannequin or a foam for the procedure. They're also recommending a single pass mark instead of a separate pass mark for the knowledge and skill components. They have also suggested that online OSCE examination might be conducted, but there has been no confirmation till now. 2020 is an year of changes in the MRCS syllabus, but we have to get acquainted with the changes and they should not affect our pass percentage. Stay tuned to this channel for further updates regarding MRCS Part B.